Good morning, everyone. I am Jeannie Alcano from Section 1YAMGO5, and for our human reproduction class today, we will be discussing congenital malformations and common cancers of the reproductive system. Here's our objectives for the first part of today's discussion, which is the congenital malformations. Number 1, explain the origin and characteristics of common congenital malformations. Number 2, discuss the difference between malformations, deformations, and disruptions and some examples of each. And number 3, examples of teratogens and their effect on fetal development. Congenital malformations, also known as congenital anomalies, congenital disorders, or birth defects, is defined as a structural or functional anomalies that occur during intrauterine life or when the baby is still inside the mother's uterus. These conditions develop prenatally and may be identified before or at birth or later in life. Some congenital anomalies can be treated with surgical and non-surgical options such as cleft lip and palate, clubfoot, and hernias, whereas others, including heart defects, neural tube defects, and Down syndrome, can cause lifelong impacts. Although approximately 50% of all congenital anomalies cannot be linked to a specific cause, there are some known factors such as genetic factors, socioeconomic and demographic factors, environmental factors, infections, and maternal nutritional status. So let us now discuss the most common severe congenital anomalies, which are the neural tube defects, heart defects, and Down syndrome. Let's start with neural tube defects. It is a severe birth defects of the brain and spine and occurs when the neural tube does not close properly. The neural tube forms the early brain and spine, and if it doesn't close properly, it would affect the formation of the spinal cord and the brain. Neural tube defects develop very early during pregnancy, often before a woman knows she is pregnant. The two most common neural tube defects are the spina bifida, or a spinal cord defect, and anencephaly, or a brain defect. Spina bifida is a condition that affects the spine and is usually apparent at birth. Spina bifida can happen anywhere along the spine if the neural tube does not close all the way. When the neural tube does not close all the way, the backbone that protects the spinal cord doesn't form and close as it should. This often results in damage to the spinal cord and nerves. The three most common types of spina bifida are spina bifida occulta, meningocele, and myomeningocele. Spina bifida occulta is the mildest type of spina bifida. It is sometimes called hidden spina bifida. With it, there is a small gap in the spine but no opening or sac on the back. The spinal cord and the nerves usually are normal, and many times spina bifida occulta is not discovered until late childhood or adulthood. This type of spina bifida usually does not cause any disabilities. Meningocele is another type of spina bifida. With meningocele, a sac of fluid comes through an opening in the baby's back, but the spinal cord is not in this sac. There is usually little or no nerve damage, and this type of spina bifida can cause minor disabilities. The last type is a myomeningocele. When people talk about spina bifida, most often they are referring to myomeningocele. It is the most serious type of spina bifida, and with this condition, a sac of fluid comes through an opening in the baby's back. Part of the spinal cord and nerves are in this sac and are damaged. This type of spina bifida causes moderate to severe disabilities such as problems affecting how a person goes to the bathroom, loss of feeling in the person's legs or feet, and not being able to move the legs. Another common type of neural tube defect is anencephaly. It is a serious birth defect in which a baby is born without parts of the brain and skull. As the neural tube forms and closes, it helps forms the baby's brain and skull, spinal cord, and backbones. Anencephaly happens when upper part of the neural tube does not close all the way. This often results in a baby being born without the front part of the brain or the forebrain and the thinking and coordinating part of the brain, which is the cerebrum. The remaining parts of the brain are often not covered by bone or skin when a baby have anencephaly. The next common congenital anomaly is the congenital heart defects. It is a problem with the structure of the heart and it is present at birth. Congenital heart defects are the most common type of birth defect that involves the walls of the heart, the valves of the heart, and the arteries and veins near the heart. They can disrupt the normal flow of blood through the heart. The blood flow can slow down, go in wrong direction or to the wrong place, or be blocked completely. Another common congenital malformations is the Down syndrome, or also referred to as trisomy 21. It is a condition in which a person has an extra chromosome. Typically, a baby is born with 46 chromosomes. Babies with Down syndrome have an extra copy of chromosome 21. This extra copy changes how the baby's body and brain develop, which can cause both mental and physical challenges for the baby. Even though people with Down syndrome might act and look similar, each person has different abilities. People with Down syndrome usually have an IQ in the mildly to moderately low range and are slower to speak than other children. Some common physical features of Down syndrome includes a flattened face, especially the bridge of the nose, almond-shaped eyes that slants up, a short neck, small ears, a tongue that tends to stick out of the mouth, tiny white spots on the iris of the eye, small hands and feet, a single line across the palm of the hand, small pinky fingers that sometimes curves towards the thumb, poor muscle tone or loose joints, and they are also shorter in height as children and adults. Now let us discuss the differences between malformations, deformations, and disruptions. The term malformation is derived from the Latin words malus, meaning bad or wretch, and formare, meaning to form or to shape. A malformation is an abnormality in the shape or structure of an organ, body part, or larger section of the body resulting from an intrinsically dysfunctional developmental process. In other words, the genetic instructions for development are faulty, interfered with, or both. Underlying mechanisms include altered tissue formation, growth or differentiation due to genetic, environmental, or combination of factors. Some examples of malformations include septal defects or holes in the heart, cleft lip or palate, and diaphragmatic hernia. First example is septal defects, and it has two types, the atrial and ventricular septal defect. An atrial septal defect is a birth defect of the heart in which there is a hole in the wall or the septum that divides the upper chambers or the atria of the heart. A hole can vary in size and may close on its own or may require surgery. The hole increases the amount of blood that flows through the lungs, and over time, it may cause damage to the blood vessels in the lungs. Damage to the blood vessels in the lungs may cause problems in adulthood, such as high blood pressure in the lungs and heart failure. Other problems may include abnormal heartbeat and increased risk of stroke. A ventricular septal defect, on the other hand, happens during pregnancy if the wall that forms between the two ventricles does not fully develop, leaving a hole. In babies with a ventricular septal defect, blood often flows from the left ventricle through the ventricular septal defect to the right ventricle and into the lungs. This extra blood being pumped into the lungs forces the heart and lungs to work harder. Over time, if not repaired, this defect can increase the risk for other complications, including heart failure, high blood pressure in the lungs called pulmonary hypertension, irregular heart rhythms called arrhythmia, or stroke. The second example is the cleft lip or cleft palate. Cleft lip and palate are birth defects that occur when a baby's lip or mouth do not form properly during pregnancy. Together, these birth defects commonly are called orofacial clefts. Cleft lip and cleft palate are openings or splits in the upper lip, the roof of the mouth, or the palate, or both. Cleft lip and cleft palate results when the facial structures that are developing in an unborn baby doesn't close completely. Cleft lip and cleft palate are among the most common birth defects that are commonly occur as isolated birth defects but are also associated with many inherited genetic conditions or syndromes. Having a baby born with a cleft can be upsetting, but cleft lip and cleft palate can be corrected. In most babies, a series of surgeries can restore normal function and achieve a more normal appearance with minimal scarring. Third example is the diaphragmatic hernia. Diaphragmatic hernia is a birth defect where there is a hole in the diaphragm, or the large muscle that separates the chest from the abdomen. Organs in the abdomen such as intestines, stomach, and liver can move through the hole in the diaphragm and upwards into the baby's chest. When an organ pushes through the hole, it is called hernia. A diaphragmatic hernia can prevent the baby's lungs from developing completely, causing breathing difficulties for the baby at birth. And now let us proceed to deformations. The word deformation is derived from the Latin deformare, equivalent to de, or departing from or reversing, and formare, which means to form or shape. A deformation is an anomaly in the form, shape, or position of a body part or section that results from mechanical forces in the embryo or fetus. Deformations may result in loss of symmetry, altered alignment, abnormal position, or distorted configuration. Deformations can have extrinsic or intrinsic causes. Examples are club foot, congenital hip dislocation, and infantile mandibular asymmetry. Clubfoot is a congenital condition that causes a baby's foot to turn inward or downward. It can be mild or severe and occur in one or both feet. In babies who have clubfoot, the tendons that connect their leg muscles to the heel are too short. These tight tendons cause the foot to twist out of shape. Know that having clubfoot is not a painful condition for your baby. Most of the time, clubfoot can be corrected while your child is still a baby. Next is congenital hip dislocation. It occurs when a child is born with an unstable hip. It is caused by abnormal formation of the hip joint during the early stages of fetal development. Another name for this condition is developmental dysplasia of the hip. This instability worsens as your child grows. The ball and socket joint in the child's hip may sometimes dislocate. This means that the ball will slip out of the socket with movement and the joint may sometimes completely dislocate. According to the American Family Physician, 1 out of every 1,000 infants is born with a dislocated hip. Next is the infantile mandibular asymmetry, also known as facial asymmetry, is a naturally occurring phenomenon that is often due to differences in the mandibular dimensions of the right and left sides of face. The point where normal asymmetry turns abnormal cannot be easily defined, and no standards exist by which a judgment of abnormality can be made. In short, this happens when the left and right side of the face is not symmetrical. And now let us proceed to disruptions. Disruptions literally means to break apart, from the Latin words dis indicating apart or removal, and rompere meaning tear down. The term refers to the breaking apart of body structures that are otherwise developing normally. In other words, disruption is an anomaly of an organ or body structure resulting from an extrinsic factor that interferes with or disrupts an originally normal developmental process. For example, certain types of maternal infection or drug use at a critical time in pregnancy have the potential to arrest the developmental process in the specific fetal tissues. Examples include amniotic band complex, some transverse limb deficiencies, and Mobius sequence. Amniotic band complex is a rare condition caused by strands of the amniotic sac that separates and entangle digits, limbs, or other parts of the fetus. These constrictions can cause a variety of problems depending on where strands are located and how tightly they are wrapped. It is believed that amniotic band complex occurs when the inner membrane or the amnion ruptures or tears without injury to the outer membrane. The developing fetus is still floating in fluid but is then exposed to the floating tissue from the ruptured amnion. This floating tissue can become entangled around the fetus. Next example is the transverse limb deficiency. It is a congenital anomaly that appears as an amputation of an arm, leg, or digit or toe. The limb is missing the terminal or distal segment with preservation of all the segments proximal to the missing segment. Radiographs are strongly recommended and can be essential to confirm the condition and characterize the bony anatomy. The last example is the Mobius sequence. It is a rare neurological disorder characterized by weakness or paralysis of multiple cranial nerves, most often the 6th and the 7th nerves. If the 7th nerve is involved, the individual with Mobius syndrome is unable to smile, frown, raise their eyebrows, or close the eyelids. If the 6th nerve is affected, the eye cannot turn outward past the midline. Other abnormalities include underdevelopment of the pectoral muscles and defects of the limbs. So that's the difference between malformations, deformations, and disruptions.
So, a pleasant day everyone. My name is Ana May Panoy and today I will continue the report of Miss Jenny Elcano, which is the congenital malformations, objective number 3. So, objective number 3 is examples of teratogens and their effect on fetal development. So teratogens are drugs, chemicals, or even infections that can cause abnormal fetal development. So common teratogens include some medications, recreational, drugs, tobacco, products, chemicals, alcohol, certain infections, and in some cases, uncontrolled health problems in the birthing parent. One of the most common teratogen is alcohol. So alcohol is a well-known teratogen that can cause harmful effects on the fetus after exposure at any time during pregnancy. So examples of teratogens are the following. The first one is tobacco. The second one is alcohol. The third one is drugs or medication. The fourth one is infections. So let's discuss first the effects of tobacco. So smoking during pregnancy increases the risk of health problems for developing babies, including preterm birth, low birth weight, and birth defects of the mouth and lip. Smoking during and after pregnancy also increases the risk of sudden infant death syndrome. Let's proceed. The effects of alcohol to the fetal development. So alcohol can pass from the mother's blood into the baby's blood. It can damage and affect the growth of the baby cells. Brain and spinal cord cells are most likely to have damage. The term fetal alcohol spectrum disorder describes the range of alcohol effects on a child. So the next one is drugs or medications. The effects of drugs or medications to the fetal development is that drugs or medication taken by the mother may cross the placenta and reach the developing fetus. The possible effects may include developmental delay, intellectual disability, birth defects, miscarriage, and stillbirth. So, taking drugs during your pregnancy also increases the chance of birth defects, premature babies, underweight babies, and stillborn births. So, exposure to drugs such as marijuana, also called weed, ganja, dope, or pot, and alcohol before birth has been proven to cause behavior problems in early childhood. Also, another examples of teratogen may include cocaine, like that, or any chemical substance. So now let's proceed. Let's go to the infections. What are the effects of infections to the fetal development? The infection may affect the placenta, harm the developing baby, cause premature labor, or lead to birth of abnormalities. Uterine infections can also make labor more dangerous and difficult. Some individuals experience organ failure and other life-threatening complications. So, the following are some common maternal health conditions or problems a woman may experience during pregnancy. So, the first one is urinary tract infections or UTI. Second one is mental health conditions. Third is hypertension or high blood pressure. Fourth is obesity and weight gain. And the last one is infections. So those teratogens are harmful for the baby or harmful for the fetal development because, as what I've said earlier, it can cause complications to the baby and also to the mother. So I guess that would be all. Thank you for listening, everyone. Again, my name is Ana May Pano, and have a great day. Thank you.
Good morning, everyone. I am Angeline Ichano, and I will discuss to you the early symptoms of male and female reproductive cancer. So, first, I will discuss the early symptoms of male reproductive cancer. So, cancer may develop in anyone at any time, but historically, cancer is diagnosed in men more often than women. Men are more likely to have been exposed to industrial hazard that may increase their cancer risk. Some cancers only affect men because they develop in the male reproductive system, which includes the prostate, testicles, and penis. So there are three types of male reproductive cancer: the prostate cancer, and testicular cancer, and penile cancer. I will be discussing first the prostate cancer. So the prostate is a gland that contributes to the production of semen, which carries sperm from the testicle. Prostate cancer is one of the most types of cancer, and many prostate cancers grow slowly and are confined to the prostate gland, where they may not cause serious harm. However, while some types of cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. So, prostate cancer that's more advanced may cause signs and symptoms such as the frequent urination, weak or interrupted urine, or the need to strain to empty the bladder. The urge to urinate frequently at night, blood at uterine, discomfort or pain when sitting caused by an enlarged prostate, and blood in the semen. So, if cancer has spread outside of the prostate gland, symptoms may include pain in back, hips, thighs, shoulders, or other bones, swelling or fluid buildup in the legs or feet, unexplained weight loss, fatigue, and change in bowel habits. So let's move on to the testicular cancer. Testicular cancer occurs in the testicles, which are located inside the scrotum, a loose bag of skin underneath the penis. So the testicles produce male sex hormones and sperm for reproduction. So the early symptoms of a testicular cancer is a lump or enlargement in either testicle, a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, a sudden collection of fluid in the scrotum, pain or discomfort in the testicle or the scrotum, enlargement or tenderness of the breast, back, and lastly the back pain. So let's move on to the penile cancer. Penile cancer is a type of cancer that begins in or on the penis. Cancer begins when cells grow out of control, causing a tumor to form. So the early symptoms of a penile cancer is first, the changes in color of the penis. Second, the unexplained growths or sores. Discharge from the penis, including the blood from the top or under the foreskin. Unexplained plants, lesions or rashes. Small crusty bumps, swelling of the penis, or a lymph nodes in the groin area. Okay, so that's the early symptoms of male reproductive cancers, and now let's talk about the early symptoms of female reproductive cancer. So some cancers only affect women rather, because they develop in woman's reproductive system, which includes the uterus, fallopian tubes, ovaries, cervix, vagina, and vulva. So there are types of gynecologic cancer. First is the cervical cancer, second is the ovarian cancer, third uterine cancer, and fourth one is a vaginal cancer, and lastly the vulvar cancer. So first let us talk about the cervical cancer. So cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Various strains of the human papillomavirus or HPV, a sexually transmitted infection, play a role in causing most cervical cancer. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. So, the signs and symptoms of more advanced cervical cancer include: first is the vaginal bleeding after intercourse, between periods, or after menopause. The second is the watery, bloody vaginal discharge that may be heavy and have a foul odor. And lastly, the pelvic pain or pain during intercourse. So let's move to the ovarian cancer. Ovarian cancer is a growth of cells that forms in the ovaries. The cells multiply quickly and can invade and destroy healthy body tissue. So the female reproductive system contains two ovaries, one on each side of the uterus. The ovaries, each about the size of an almond, produce eggs, which is the ova, as well as the hormones estrogen and progesterone. When ovarian cancer first develops, it might not cause any noticeable symptoms. When ovarian cancer symptoms happen, they are usually attributed to other, more common conditions. So, the early signs and symptoms of ovarian cancer may include abdominal bloating or swelling, quickly feeling full when eating, weight loss, discomfort in the pelvic area, fatigue, back pain, changes in bowel habits such as constipation, and lastly, a frequent need to urinate. Okay, so uterine cancer. Uterine polyps are growth attached to the inner wall of the uterus that extend into the uterine cavity. Overgrowth of cells in the lining of the uterus leads to the formation of uterine polyps, also known as endometrial polyps. These polyps are usually non-cancerous, although some can be cancerous or can eventually turn into cancer. The early signs and symptoms of uterine polyps include irregular menstrual bleeding, for example, having frequent, unpredictable periods of variable length and heaviness, bleeding between menstrual periods, excessively heavy menstrual periods, vaginal bleeding after menopause, infertility. Some women have only light bleeding or spotting, others are symptom free. So, let's talk about the vaginal cancer. Vaginal cancer is a rare cancer that occurs in your vagina, the muscular tube that connects your uterus with your outer genitals. Vaginal cancer most commonly occurs in the cells that line to the surface of your vagina, which is sometimes called the birth canal. Early vaginal cancer may progresses. Vaginal cancer may cause signs and symptoms such as unusual vaginal bleeding, for example, after intercourse or after menopause, watery vaginal discharge, a lump or mass in your vagina, painful urination, frequent urination, constipation, and pelvic pain. Okay, so the last one is a vulvar cancer. Vulvar cancer is a type of cancer that occurs on the outer surface area of the female genitalia. The vulva is the area of skin that surrounds the urethra and vagina, including the clitoris and labia. The signs and symptoms of vulvar cancer may include itching that doesn't go away, pain and tenderness, bleeding that isn't from menstruation, skin changes such as color changes or thickening, a lump, wart-like bumps, or an open sore. So that's all in my report, and Villar will continue it.
Good day everyone, I am Princess Kit Villar and I am here to discuss a continuation of Echana's report. And now I will discuss about the risk factors and causes of the male and female reproductive cancer. First is the cervical cancer causes. Cervical cancer begins with unusual cancers in your tissue. Most cases are linked to infections with HPV, which is preventable with vaccine. Different types of HPV can cause skin warts, genital warts, and other skin disorders. Others are linked to cancers involving the vulva, vagina, penis, anus, tongue, and tonsils. Risk factors for cervical cancer include many sexual partners. The greater your number of sexual partners and the greater your partner's number of sexual partners, the greater your chance of acquiring HPV. Early sexual activity. Having sex at an early age increases your risk of HPV. Other sexually transmitted infections or STIs. Having other STIs such as chlamydia, gonorrhea, syphilis, and HIV increases your risk of HPV. A weakened immune system. You may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. Smoking. Smoking is associated with squamous cell cervical cancer. Exposure to miscarriage prevention drug. If your mother took a drug called dietestebestrol or DES while pregnant, you may have an increased risk of a certain type of cervical cancer called clear cell adenocarcinoma. Second is the ovarian cancer. The causes of ovarian cancer happens when cells in the ovaries grow and multiply uncontrollably, producing a lump of tissue called a tumor. It's not clear exactly why this happens, but there are factors which may increase your risk of getting ovarian cancer. So, factors that can increase your risk of ovarian cancer include older age. The risk of ovarian cancer increases as you age. It most often diagnosed in older adults. Inherited gene changes. A small percentage of ovarian cancers are caused by genes changes you inherit from your parents. Family history of ovarian cancer. If you have blood relatives who have been diagnosed with ovarian cancer, you may have an increased risk of the disease. Being overweight or obese. Being overweight or obese increases the risk of ovarian cancer. Postmenopausal hormone replacement therapy. Taking hormone replacement therapy to control menopause signs and symptoms may increase the risk of ovarian cancer. Endometriosis. Endometriosis is an often painful disorder in which tissues similar to the tissue that lines the inside of your uterus grows outside your uterus. Age when menstruation started and ended. Beginning menstruation at an early age or starting menopause at a later age or both may increase the risk of ovarian cancer. Uterine cancer or the endometrial cancer, the causes of this is actually the doctors or the researchers don't know what causes endometrial cancer. What's known is that something occurs to create changes or mutations in the DNA of the cells in the endometrium, the lining of the uterus. Factors that increase the risk of endometrial cancer include changes in the balance of female hormones in the body. The ovaries make two main female hormones, estrogen and progesterone. Fluctuation in the balance of these hormones cause changes in the endometrium. More years of menstruation. Starting menstruation at an early age before age 12 or beginning menopause later increases the risk of endometrial cancer. The more periods you've had, the more exposure your endometrium has had to estrogen. Obesity. Being obese increases your risk of endometrial cancer. This may occur because excess body fat alters your body's balance of hormones. An inherited colon cancer syndrome. Lynch syndrome, also called hereditary non-polyposis colorectal cancer, or HNPCC, is a syndrome that increases the risk of colon cancer and other cancers, including endometrial cancer. Lynch syndrome is caused by a gene mutation passed from parents to children. Vaginal cancer. Causes of vaginal cancers. Researchers do not yet know the exact causes of vaginal cancer. Generally, cancer develops when cells do not die at a natural point in life cycle. Instead, they continue to grow and spread, draining energy from the area around it. However, the researcher identified several risk factors for developing vaginal cancer. These risk factors include increasing age. Your risk of vaginal cancer increases as you age. Most people who are diagnosed with vaginal cancer are older than 60. There are other risk factors that I discussed recently, and it linked to an increased risk of vaginal cancer include multiple sexual partners, early age at first intercourse, smoking, and HIV infections. Vulvar cancer. Vulvar cancer, so the causes of this is when cell growth is out of control. Most cancers harm the body when damaged cells divide uncontrollably to form lumps or masses of tissues or tumor. Tumor can grow and affect body functions. A benign tumor stays in one place and does not spread, but a malignant tumor spreads and causes further damage. Experts do not know exactly why cells start to grow too fast, but certain risk factors increase the chance of developing the disease, and these may include being exposed to human papillomavirus or HPV. HPV is sexually transmitted infection that increases the risk of several cancer, including vulvar cancer and cervical cancer. Many young, sexually active people are exposed to HPV, but for most, the infection goes away on its own. For some, the infection causes cell changes and increases the risk of cancer in the future. Having a history of precancerous conditions of the vulva. Vulvar intraepithelial neoplasia is a precancerous condition that increases the risk of vulvar cancer. Most instances of vulvar intraepithelial neoplasia will never develop into cancer, but a small number do go on become invasive vulvar cancer. Breast cancer. Researchers knows that breast cancer occurs some breast cells begin to grow abnormally. These cells divide more rapidly than healthy cells do and continue to accumulate, forming a lump or a mass. Cells may spread through your breast to your lymph nodes or to other parts of your body. Breast cancer more often begins with cells in the milk-producing ducts. Breast cancer may also begin in the glandular tissue called lobules or in other cells or tissue within the breast. Factors that are associated with an increased risk of breast cancer include being female, Women are much more likely than men are to develop breast cancer. A personal history of breast conditions. If you've had a breast biopsy that found lobular carcinoma in situ, or LCIS, or atypical hyperplasia of the breast, you have an increased risk of breast cancer. A personal history of breast cancer. If you had a breast cancer in one breast, you have an increased risk of developing cancer in other breasts. A family history of breast cancer. If your mother, sister, or daughter was diagnosed with breast cancer, particularly at a young age, your risk of breast cancer is increased. Still, the majority of people diagnosed with breast cancer have no family history of the disease. Inherited genes that increase cancer risk. Certain gene mutations that increase the risk of breast cancer can be passed from parents to children. Radiation exposure. If you receive radiation treatments to your chest as a child or young adult, your risk of breast cancer is increased. Postmenopausal hormone therapy. Women who take hormone therapy medications that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. The risk of breast cancer decreases when women stop taking these medications. Drinking alcohol. Drinking alcohol increases the risk of breast cancer. Take notes. A breast cancer risk factor is anything that makes it more likely you'll get breast cancer. But having one or even several breast cancer risk factors doesn't necessarily mean you'll develop breast cancer. Many women who develop breast cancer have no known risk factors other than simply being women. So those are the female reproductive cancers, and now I will discuss the 3 male reproductive cancer. First is the testicular cancer. This cancer wasn't clear what causes testicular cancer in most cases, but researchers and doctors knows that testicular cancer occurs when healthy cells in a testicle become altered. Healthy cells grow and divide in an orderly way to keep your body functioning normally. Factors that may increase your risk of testicular cancer include an undescended testicle. The testes form in the abdominal area during fetal development and usually descend in the scrotum before birth. Men who have a testicle that never descended are the greater risk of testicular cancer than are men whose testicle descended normally. Abnormal testicle development. Conditions that cause testicles to develop abnormally, such as Klinefelter syndrome, may increase your risk of testicular cancer. Family history. If family members have a testicular cancer, you may have an increased risk. Penile cancer. Penile cancer, or cancer of penis, is when cells grow out of control on or in a man's penis. It often starts in skin cells and can work its way inside. It is rare, but it can be treated, especially if it's found early on. Various risk factors can affect penis health, some modifiable and some may not, and may include heart disease, diabetes, and related conditions. Heart disease, diabetes, high blood pressure, high cholesterol, and obesity can increase the risk of erectile dysfunction. Certain medications. Erectile dysfunction is a possible side effect of a number of common medications, including blood pressure drugs, antidepressants, prescription sleep medicines, ulcer drugs, and drugs for prostate cancer. Prostate cancer treatment. Surgical removal of a prostate gland and surrounding tissues as treatment for prostate cancer might cause urinary incontinence and erectile dysfunction. Excessive drinking. Excessive drinking can contribute to reduced libido, erectile dysfunctions, and poor choices in sexual behaviors. Unsafe sex. Unprotected sex, sex with multiple partners, and other risky sexual behaviors increase the risk of sexually transmitted infections. Piercings. A penis piercing can cause a skin infection and disrupt urinary flow. Depending where the piercing is placed, it might also worsen your ability to achieve an erection or orgasm. Prostate cancer. Prostate cancer begins when cells in the prostate develop changes in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The changes tell the cells to grow and divide more rapidly than normal cells do. The abnormal cells continue living when other cells would die. Factors that can increase your risk of prostate cancer include older age. Your risk of prostate cancer increases as you age. Its most common age 50. Family history. If a blood relative, such as parent, sibling, or child, has been diagnosed with prostate cancer, your risk may be increased. Obesity. People who are obese. Obesity. People who are obese may have a higher risk of prostate cancer compared with people considered to have a healthy weight. Those studies have mixed results. In obese people, the cancer is more likely to be more aggressive and more likely to return after initial treatment.